Hypertension is the number one risk factor of deaths globally, affecting more than 1 billion people worldwide. Today, we have with us Dr. R. Kasliwal, who's the Chairman, Heart Institute, Medanta, who will help us understand what is hypertension and what are the signs associated with it. Welcome to E-Times, Dr. Kasliwal. So, Doctor, let's start by understanding what is hypertension and the theme of World Hypertension Day this year.
The mission statement, the theme of the World Hypertension Day 2022 is actually measure your blood pressure accurately, correct it, and live longer. This has control it and live longer. These three sentences have a huge meaning in a country where if you see the latest guidelines from the ICMR, the hypertension control initiative that they have initiated, 1 in 4 adults in India have hypertension. So you can imagine the sheer quantum of the problem that we have. And it doesn't stop there. They said less than 10% of people, of hypertensive people, are actually under control. So we start with very somber statistics on this World Hypertension Day, where the main theme is measure your blood pressure accurately, control the blood pressure, and live longer. These three phrases are so nicely worded that it tells you the whole story for whole of South Asia, but particularly for us. 133 crore people, you know how many adults are there. That's what I've always been thinking and doing, that, look, can we save hundreds and thousands of people? And that's, I'm sure, with your very powerful medium, you can get it across to thousands of people.
Yes, the theme is measuring your blood pressure correctly. So if we delve deep into it, and what exactly do they mean by that?
Yes. See, the thing is that today, what is given most importance is home blood pressure recording, because people say, look, I might go to the doctor's office, I'm parking my car and running, my blood pressures may go up. And also some people say that this is white coat hypertension. When I see the doctor, it goes up. So home blood pressure monitoring is supposed to be ideal. And home blood pressure monitoring, let's delve into it right away, that the rule these days is digital. Everybody will have a digital sphygmomanometer. The mercury is out, it's a pollutant. So the first thing you have to do is to not have a smoke or coffee or any stimulant drug, but be relaxed, no cell phones. And the upper arm should be bare, of no clothes, and then you tie the cuff and discard the first reading, and of the second and third reading, the low reading is your exact reading.
Okay.
The normal blood pressure is 120/80 or below. Between 120 to 139 and 80 to 89 is the period where you have pre-hypertension. And that is an important thing to recognize, because this is the blood pressure reading that you can actually start your non-pharmacological treatments immediately. And I'll come to what are the commonest causes. But you asked about how to take the blood pressure. Well, this is how you should take it.
So my next question is connected to what you just spoke about. A lot of people, I've heard them saying that your age, if you are, let's say 40, it's safe to have an upper reading of 140. If you are 50, it's safe to have a reading of 150, the upper reading. What do you have to say about this? Is this theory valid?
You're taking me back to my med school days. And this theory has been outdated for about 40 years or so. The pressure at home should be 130/80. The situations in which it could be 10 points higher are, for example, chronic kidney disease. Or, for example, a person who has had a stroke, a head stroke. There you would like to keep a blood pressure at that level. Otherwise, whether you are 30 or whether you're 80, if you're normal, pressure should be around 130/80 or maybe 135 to 85. That's what it is. So this
Okay.
was not a theory. This was long back. Yeah.
Thanks for clarifying it, because I see a lot of people quoting it very carelessly, and I'm sure a lot of people tend to believe that your upper limit can be in sync with your age. So, doctor, this brings me to the next question. When we talk about, let's say, someone who's consistently getting a reading which is above, let's say, above 130, what should be the first steps?
So, in this whole gamut, the most important thing is that why so many Indians are getting high blood pressure. Number one is harmful dietary practices, which we all follow. Number two, sedentary lifestyle. Number three, obesity. Number four, stress, high salt food. These are some of the causes which can lead to high blood pressure. And you use a very good word, carelessly. It is really carelessness. Why should you let yourself go into that stage?
Yeah.
But we'll come to that. The other thing is that people say, look, I'm sorry, but I'm on the plane every other day, and so I eat and my blood pressures go. Well, if you want to invite disease, that's your problem. But it is very well known that the four principal causes are stress, sedentary lifestyles, obesity, and diet. We are a snacky people, we all agree. We are a snacky
Yes.
people. And salt and ghee and all these things. But we'll have to control it some stage. And you can't stay that up to 50 I'll be fine and then I'll do it. No, this starts at age 15, 20. Because that's where we are eating all the junk food. And by junk, I don't mean just the Western kind of food, but we may be eating junk at home.
Yeah.
So now when you come to answer your question, that I am doing all these things, and my spouse says, well, look, your blood pressure is 140 by 100 and your age is only 35. What are you going to do about it? Well, this is exactly it. Now you've hit it on the head that first I'll start to look at my diet carefully. I will see to it that I exercise. Of course, everybody has to be in front of the camera today, or on your iPads, or this is. But then you don't have to sit. You can stand up and there is something called non-exercise activity thrombogenesis, what we call as NEAT, and you can stand up with your on a podium and do your work, and walk around and do your work. So activity is important. Harmful dietary practices have to be abandoned, and they're not very difficult. Let me take 40 years ago, when this DASH diet was introduced, dietary practices for stopping hypertension. What does it say? It's exactly what our vegetarians are doing. Fruit, green vegetables, and shun and use good oils. So that is where your question comes in very beautifully into play, because once it is 140/95 and we let loose at that stage, then of course it's going to gallop, whatever your age may be. Because our work, if it is in the front of the computer, it is going to be there. What can we do about it? We did. Right. And a target should be, look, why can't I get my blood pressure down to 130 by 80? I can do it. Not with stress, because then you're adding another stress. But with clear thinking that, look, I'm going to get up, I'm going to exercise, go out, exercise, hear the music of the birds, feel relief, it's me time. And here comes a very important thing, which is our Eastern way of life: yoga, meditation, mindfulness. From housetops, people are shouting these things. This is where it comes into play maximally. So if we are cognizant that no, age plus 100 is not my blood pressure, but 130 by 85 is what my blood pressure should be, lower than that. Because that way, my granddad, who's 75 years old, his pressure should be 175 by 100. He'll get a stroke.
So, Dr. Kasliwal, tell me, is there a possibility that someone who's been showing regular blood pressure readings suddenly gets a heart attack or a stroke?
So what you're saying is, are there early signs of hypertension?
Yes, hypertension, yes.
Actually, to be honest, it's not like getting a heart attack where you have 8 symptoms, one of them will be present. But if you look at it, sometimes you get headaches, but by the time you reached home, it's gone. So you say, yeah, it's okay. Sometimes you get vision problems, or you get undue fatigue, or you get shortness of breath. And very importantly, sometimes you get pounding in the chest. Why? Because the pressures are high. What does it take to just get your BP checked up? If the BP is even slightly on the higher side, you say, all right, I'm going to recheck it tomorrow or day after. That's all you have to do. So these are some of the, as you call, telltale signs. And one sign which is very important sometimes is nosebleeds, epistaxis. That can tell you that yes, your blood pressure was high, and as a result of that, you got Naxir, as it is called. So these are some of the signs by which you can pick up hypertension. When you said about telltale signs, one thing I forgot to mention is very common. My patients tell me is irritability, chidchidapan. They say, we were quite happy people, yeah. That's because the blood pressure has affected them. It's going up, and then they lose control. So those are some of the things which we should follow, and let our body tell us, and then we take it from there. High blood pressure is one of those conditions where truly detection is not difficult, treatment is not. What does it matter? The doctor will say, look, take a few meds, okay, but at least you will be protected from brain stroke, heart stroke, and kidney damage. Na?
A lot of people do not get onto hypertension medicines because they feel that once they started, they can get off it. Is that true?
Yes and no. Those whom you have caught at an early stage with diet, exercise, change of their thinking, they can definitely get away with any meds.
Okay.
But those who have come late and their blood pressures range between 170, 80 to 110, it will be silly to say कि नहीं जी आप योगी कर रहे हो तो ठीक हो जाओगे. Of course, lifestyle will matter tremendously, but initially you will have to bring it down. So I tell my patient, because everybody asks this question, that look, you're a diabetic. Won't you take your medication for your entire life? But then you don't ask the diabetologist. So here also, if your arteries have become stiff, and there are methods to map that, it's called arterial stiffness or pulse wave velocity. Once the pulse wave velocity has crossed a certain limit, yes, I can put you gradually on a low level of medication, but maybe you have to take some medication. Okay. So that's where your interview started with. Early. How early can we detect your blood pressure? Is there any harm in taking your blood pressure of your kin at age 25 or 30? Nothing. You're not putting in a wire or a tube or anything. It's just taking blood pressure. Seen very few families where everybody walks together, everybody eats a low salt diet, everybody listens to music or exercises or mindfulness together. Those are activities which are important. You know, Sundays are spent playing badminton or table tennis. Those things have to be encouraged. We are in a fast-moving, hassle-filled world. Sometimes the television and the news, which are essential, I mean, those guys are doing their job, also affect us.
Yes.
True. Tremendously. So to answer your question, will I have to take it lifelong? Well, it depends upon you and the stage at which it is picked up. I would not say that yes, at every stage it can be taken care of. There are safe medications. There are what we call as fixed dose combinations, and you can get away with it.
Thank you so much for taking out time to talk to us. And this was a very, very informative session. I'm sure our viewers will also get to learn a lot. Thank you so much, Doctor.
Thank you so much. I appreciate the time you spent. Thank you.